Welcome back and thank you for staying with us. Now, power cuts worsened the water crisis in Polokwane and surrounding areas, which already suffered several weeks of water shortages due to no maintenance. Health authorities cancelled all elective operations to focus only on emergencies. Clinics have also been severely affected as most use boreholes that require electricity to pump water. Now, for more on this, we're joined by Limpopo Health MEC Phophi Ramathuba to just tell us how they are coping with the situation. MEC, before we start with our conversation, I'm just going to ask you to move a little bit back for us so that we properly frame you, and you just tilt down your advice just a touch, not too much. Thank you, MEC. Now, firstly, just tell me what is really the situation in, the province of Limpopo when it comes to the fact that South Africa is facing such a huge power crisis.
Afternoon to all your viewers out there, and thank you for inviting us. What we can indicate is that it's unfortunate that hospitals, even though they render essential services, have not been exempted when it comes to load sheddings, and that this is a process that we are currently engaging the leadership of ESCOM, and we have seen in some institutions, for instance, Mankweng and Mecklenburg, those two facilities who have been successful in making sure that they are not experiencing load shedding like other facilities are. But however, the current challenges, especially when we move to in the past 2 weeks, you will remember that we were at stage 5 and 6. It has been very difficult and tough for us. And that is what led us into saying we need to really prioritize, especially when it comes to Pietersburg Hospital, which is our biggest hospital in the province and the tertiary. The situation was worsened by, as you've indicated, the shortage of water. And municipality was not able to provide, because even the community around here, those of us who reside in Pietersburg, in Polokwane, we know we have been experiencing the challenge. And what we were surviving with was the water tankers that I must appreciate that the executive mayor of Polokwane and his management have been able to assist to supply us with water tankers. But however, that will not be a normal situation. Hence, most of our elective operations in the past week, we were not able to do them. We would focus on the emergencies, because this is a referral hospital that receives all the emergencies from all the hospitals in the province.
And MEC, how are we avoiding, for instance, anybody dying because of the situation that we find ourselves in? Has a life been lost so far due to the fact that there's an electricity crisis that also translates into the water crisis as well?
As I've indicated, no emergency would be a compromise or sacrifice, no matter what the situation is. So if it's a woman who wants to give birth through cesarean section, we will definitely prioritize. If it's a gunshot, it will definitely be prioritized. Of course, if it's a routine operation that we have a plan to fix your bone, for instance, to do an ORIF, we will definitely postpone you. But because we know that you would not necessarily lose your life at that given point in time. So all our electives and planned operations were the ones that are affected, but however, the emergency ones we have not. But also at the same time, our regional hospitals, which are in the rural areas and in the periphery, we have been able to utilize them. For instance, from this whole week, we are at a Mopani district where we're trying to clear the surgical backlogs. It's very difficult to plan these operations, these rural health matters. For instance, we will be in Kansani with the gynae and urogynae to deal with some of these electives, utilizing the theater that side. But it's very difficult because you don't know what would happen. And clinicians have been raising this issue that, the planned operations, we can plan them, but without certainty, when you're not sure what's going to happen with the electricity supply, it becomes difficult. Hence, the focus will be on emergencies. But I must also indicate the impact is heavy, because yes, all our facilities We've got 41 facilities. We do have 70 generators, which are distributed amongst facilities depending on the size of the hospital. Some will operate with 3 up to 6, like your Mankweng and Petersburg. But however, we have noted that the lifespan of these generators now is becoming a problem. We were dealing this weekend with Philadelphia Hospital, where the generator has been blown completely. We have to get a new one. And if you look at the amount of diesel that we are now spending, this is the money that we have not budgeted for, because we were not anticipating that we will be spending so much on diesel in order for us to sustain our generators for alternate power supply. So, and lastly, also, if you look at our medical equipment, these are high-tech equipments that are very expensive, and the current load shedding is also having an impact on their lifespan. And unfortunately, as a rural province, we've been trying very hard to catch up with those in the cities by procuring this high-tech equipment. But the current load shedding, it might take us backwards, and that this is what we need to do. But to answer you, we are trying our level best that no life is lost because of this crisis. We rather compromise there, but make sure that nobody loses a life because we could not operate on that particular person.
And MEC, how is this going to affect, for instance, the backlog that we see, not only in Limpopo, but of course I'm asking you particularly about the province that you head. We're already a country that has a huge backlog in terms of public health when it comes to some operations, for instance, your hip replacement and things like that. And now if you have to pause that for this period and we don't know when Eskom will stop load shedding, how is this going to affect that particular backlog that you have?
This is what we're saying, that despite the fact that we came up with initiatives to say, let's take out our specialists from the urban to go and assist in clearing the backlogs in the rural hospitals, so that we can have more theatres there, we could have skills transferred. But the uncertainty that we are currently having with Eskom, it's really demoralizing to even those doctors, those specialists who are coming from all over the country to come and plow back on a volunteer through our Rural Health Matters Limpopo project. Unfortunately, this current situation, it's also having a serious impact. As you correctly said in the beginning, most of our rural hospitals and clinics rely on borehole water and supply. And when there is load shedding, because our generators, you should understand, it's usually we will connect to those areas that are very critical. You have to prioritize your ICU, your high care, your theater, your casualty, your wards. Now, issues like your laundry, issues like your borehole, they are not really your priority, because a generator might not even cope if you connect all these service area. So when you don't, your laundry is not connected, it means now without linen, that planned operation is not going to happen. Without linen, you will not be able to deal with that slate, even if you have planned operations to be done. So when you also look at your water supply, there's no way a facility or a hospital, even a clinic, can operate without water. So this is seriously having an impact on our surgical backlog. But as I've indicated, we have elevated the matter into even the leadership of Eskom to say, can hospitals be treated like essential? Because even the healthcare workers were saying, the law of this country does not even allow them to go on strike. There will never be a protected strike for healthcare workers. But when it comes to load shedding, that clause is no longer working. When we all went into hard lockdown, healthcare workers and facilities were said they must continue to function. But when it comes to load shedding, that rule is no longer applying. We are still the same facilities that render life savings procedures. We are therefore appealing to say there's in no way that hospitals must be subjected to the current load shedding, especially when the stages continue to increase and when we are not sure when is this thing going to stop? So we are hoping that this time around we will receive a positive response, because we are not doing it for the first time. I must indicate it's been for the past years that we've been writing several letters appealing, but we've reached a stage wherein we really cannot cope, and we are appealing to the leadership of ESCOM to say exempt facilities, hospitals, and allow us to focus on saving lives.
Yeah, well, thank you very much, Amisi. I imagine that this makes your job very difficult there in Limpopo. The Limpopo province's MEC, Phophi Ramathuba, they're saying she's pleading with ESCOM for not the first time, actually, to exempt hospitals from being load shed.